Good morning, everyone. Great to see everybody. We do want to welcome our members, community partners, our special guests, speakers, and sponsors. We're grateful for this opportunity to connect and thankful for all of you taking the time to be here today. Thank you for showing up. Thank you for being present. And thank you for continuing to pour so much yourselves into the work that each of you do every day. We're at a moment where California's healthcare system is under real pressure.
I think the expectations with new policies versus what counties are actually capable of doing or what they're actually funded to do has been very, very challenging.
One of the lessons learned is that when we do stand together, that we can overcome pretty significant headwinds and pretty significant odds.
I think as we look to new paradigms and new shifts, I'm seeing some incredible models in how you all as providers are looking at affordability for the consumer.
I say all the time, this is the biggest public health and environmental emergency in the Western Hemisphere, and that is not hyperbole at all.
We're really fortunate to live in a state that has made behavioral health and mental health services a major priority for the public.
We have a very good workforce that has remained. Most of our workforce is from Imperial County, born and raised. They understand our population.
It is not lost on any of us. We are all going through some very difficult times.
I have been spending the last couple months having a lot of very interesting conversations with hospital leaders across the country.
I think that one of the things that's been really successful are, the regional hospital associations, I think, have had wins here in San Diego County, Southern California, as well as the Hospital Council. I think that that partnership has been really, really effective. Attention is at a premium. And if you are unorganized, if you are kind of off message and not coordinated with the rest of your field, it's a great way to get nothing.
It's not just sitting in a room and doing all of this yourself, but telling our stories. The press, the legislature, the agencies, they have no idea what we're doing if we're not out there telling our stories.
You can't kind of, guarantee outcomes, but you really can increase your chance of success when you've got a coherent message with your brothers and sisters in your field. Because if we're not having these conversations, then we're not building the foundation that we need to be building to come out on the other end.
Only when we do this do we stop improving and start evolving. This means remaining open to the possibility that some of the anecdotes that you're encountering every day could grow into the stories that really move the needle on the advocacy you're doing, even if at this point they don't seem like they might. There is fortune in saying yes before you know where yes will take you.
Every patient we treat, every family we comfort, and every team member we support is an example of the purpose that drives us.
Our communities need and deserve a strong partnership that exists today between all of the HASD&IC members, our community partners, and the county.
When we asked them, what do you want us to tell the hospitals and healthcare systems, they told us over and over again, please tell them I said thank you. I know how hard their jobs are. I see the pressure they're under and the stress that they're facing, and I want them to know that I see that. And I am grateful for that. And go tell those CEOs to take care of the people working in the hospitals.
We have more work to do ahead. You can always count me in as a partner, and I'm incredibly grateful for this recognition. It takes a village, it takes many.
As we have these headwinds and we look to the future and to make healthcare a priority in the state, that gives me a lot of hope.
We have to remind ourselves that we provide something that people fundamentally view as a human right, as part of dignity, and they want it.
Collaboration and working together is going to be the key as we move forward. And I will say there's something special about being in a room like this. It reminds us that we're not doing the work that we're all doing alone. We're part of a community that cares deeply about our patients, families, as well as about the future of healthcare in the region.